Hi, my name's Eric Farnsworth, and as the father of two daughters, I have a question about the Zika virus. I was wondering what precautions you recommend in terms of a girl deciding to get pregnant. Should she be tested first if she thinks she may have been exposed? And the follow-up question is, if you are exposed, how long is it in your body such that it can do damage?
My name is Kathleen Antony. I'm a maternal fetal medicine specialist at the University of Wisconsin-Madison at Meriter Hospital with Unity Point Health. And that's a great question. You know, a lot of people travel to these areas that have active ongoing transmission of Zika virus disease, and they come back and they wonder, how long can I wait to get pregnant, or could I just get tested, make sure I'm negative, and then proceed with attempting conception? And currently the recommendation is that unless they had symptoms of Zika virus disease within the first 2 weeks of traveling, within the first 2 weeks of when they've returned from their destination of travel, the recommendation is not to test them. The recommendation currently is to just wait to attempt pregnancy. If people are going to get symptoms, the incubation period of Zika virus is about from 3 to 14 days. And if they do develop symptoms, those typically last for days to a week or so. Where it becomes trickier is if the person who's traveled is a male, because the Zika virus can persist in the semen. The WHO has changed their recommendation and is now recommending men and women both wait 6 months from the time of travel to attempt conception. Zika virus disease itself in adults has at least historically been thought to be more or less innocuous. It's something that, the majority of people didn't have symptoms from. Those who did have symptoms, it was generally cleared within a few weeks. People who have symptoms, the 20% of people who have symptoms, will experience symptoms like fever, a classic kind of reddish rash. That they can also get red eyes, which is called conjunctivitis. They can also get swollen lymph nodes, body aches, headaches, that kind of thing. However, in pregnancy, we've recently discovered that when Zika virus is vertically transmitted to the baby, it can have pretty profound effects. In the news, we typically see things like microcephaly, which is an extremely small head of a baby. And the reason that these babies have microcephaly is because their brains aren't developing right. And so when we look on ultrasound at these babies, we see that there's increased amount of fluid in the brain, not as much brain material as we expect to see, and some of the brain structures either didn't develop properly or are much smaller than what we expect. There can also be problems with the baby's eyes and hearing.